How's it going, guys? Medium difficulty question, pathology, step 1, internal medicine, 2 CK. 61-year-old man, 2-month history, headache, intermittent left flank pain, 10-pound weight loss during this time. Extensive history, alcoholism, smoking, illicit drug use. Physical exam shows weakness of the proximal muscles of the upper and lower extremities. Shoulder and hip muscles demonstrate augmentation of strength with repetitive testing. The patient is able to perform upward gaze for 60 seconds without a problem. MRI shows a ring-enhancing lesion in the frontal lobe. Biopsy shows small blue cells. HIV ELISA is negative. What's the most likely diagnosis? Let's just hop through. Should I say anaplastic ependymoma? Wrong fucking answer. If you don't know what's going on, you'll choose weird sounding shit. Pretty much non-existent diagnosis on USMLE. So ependymal cells are what line the ventricles in the brain and secrete CSF. You could sometimes see weird brain cancers like ependymoma, oligodendroglioma with neurofibromatosis type 1. Wrong fucking answer. Choice B, glioblastoma multiforme, wrong fucking answer. If they want this, they're going to tell you there's a large heterogeneous slash necrotic brain mass that extends through the corpus callosum. It's colloquially referred to as butterfly glioma. Wrong fucking answer. Choice C, actually real quick, I will just mention, for step 1, you need to know that glioblastoma multiforme is a grade 4 astrocytoma. Okay, so they can give you the butterfly glioma descriptor, as I just said, through the corpus callosum, and then rather than having glioblastoma multiforme as the answer, it'll just be grade 4 astrocytoma. As I already said, wrong fucking answer. Choice C, metastatic malignancy, correct answer. This is small cell bronchogenic carcinoma that's metastasized to the brain. Some of you are about to trip out because we have a singular ring-enhancing lesion, OMG, it's not multiple lesions. It doesn't have to be. Tangentially, I've made clips talking about when we have colon mets to the liver, they like to give you a liver with diffuse lesions, okay, whereas primary HCC is going to be a singular lesion, sometimes with sided lesions. But with brain mets, whether it's from lung cancer, anything going to the brain, they can give you a singular lesion. Ring-enhancing lesion doesn't have to just be toxo. It can be mets, it can be abscess, small blue cells. This is bronchogenic carcinoma. And we've got Lambert-Eaton syndrome here. I give you a couple buzzy lines. We have proximal muscle weakness that improves with activity. Okay, and then the patient is successfully able to perform upward gaze for 60 seconds without a problem. That tells you it's Lambert-Eaton, not myasthenia gravis, because myasthenia gravis, which sometimes you can see with thymoma or just idiopathic, they cannot perform upward gaze for 60 seconds. They like to tell you that in the question sometimes. They can also tell you in the STEM that the patient has difficulty, for Lambert-Eaton syndrome, that the patient has difficulty rising from a chair, but after trying a few times, can successfully do it, which makes sense. Now, you say, what's going on with the left flank pain? Well, metastatic malignancy, you can get hypercalcemia, can't you? Okay, so it's not limited to cancers where you have PTHRP, such as squamous cell carcinoma of the lung or renal cell carcinoma. Metastatic malignancy in general, hypercalcemia, and we have enough going on here, which tells us it's small cell bronchogenic carcinoma in combination with eliminating to get there. Let's just hop through the final ones. Pilocytic astrocytoma, wrong fucking answer. It's pediatric diagnosis. So they'll tell you there's solid and cystic components on imaging, so part of it looks white, part of it looks black, pretty much a non-existent diagnosis. Wrong fucking answer. Choice C, primary CNS lymphoma, wrong fucking answer. So I wrote that the HIV ELISA is negative. So primary CNS lymphoma is classically going to be AIDS patients with a CD4 count under 100. It can also be, and I've made clips on this, autoimmune disease. If they say 44-year-old woman with SLE has a ring-enhancing lesion, that's going to be primary CNS lymphoma, not toxo. Okay, so we don't have autoimmune disease here, and we have negative HIV testing. Primary CNS lymphoma, wrong fucking answer. You know the deal. When you make more content, I feel like my subscribe my channel. Appreciate your time. That's it.